The outside of the ear has a lot of different names. It's called pinna, P-I-N-N-A. It's called auricle. Okay, I don't care what you use, right? But it is ridges in it, and it's very bendable because it has elastic cartilage. So it can pick up sound better. And by having all those concentric circles, it drives the sound in. See what else I'm missing. Okay, so outer ear is from here to here. So we have the pinna, and then we have the what here?
Ear canal.
Ear canal, which is called the auditory canal, not the anal canal. I did have a student put that answer, it just kills me. This is outer ear. It is lined with spermifluous glands that secrete earwax to keep bacteria out. Then we hit this little membrane structure, and that is the tympanic membrane, which you commonly call the eardrum. It is there to intensify or actually make sounds less intense. It vibrates. It is attached to 3 little bones, and those little bones vibrate. The bone that's stuck right on the tympanic membrane is called the... Don't know. The don't know one.
Mm-hmm.
Do you know the 3 bones?
I used to, I don't know.
Here's the stapes right here that attaches to the oval window to go into the inner ear. Stapes is the stirrup. Okay. Then you have the anvil, and which is the, you know, when they're making a horseshoe, they use a mallet to bang on the anvil, make the stirrup. We have the stapes, we have the incus, and we have the malleus. The incus is the anvil, the malleus is the mallet. The malleus is attached to the tympanic membrane. Take the mallet, we hit the anvil, the incus, and we make the stapes the stirrup.
Interesting.
Okay. Trying to help you remember. Then once we enter into the inner ear through the oval window, the sounds go into the vestibula, this part I'm holding, and then sound waves will go into the cochlea, the snail-like structure that contains tiny hairs, and those tiny hairs vibrate and they send the information out the cochlear portion of the vestibular cochlear cranial nerve number 8. For balance, we have these 3 semicircular canals. You can see that they're orientated like in the body. You have them through the 3 planes of the body. The horizontal, which is also called the transverse, right? The sagittal, and then the one here at a kind of an angle, right? This is the way you tell where you're at in time and space. There's filled with fluid and hairs, and they move in little crystals. Sometimes the crystals get stuck, and then you have vertigo. And you stand up, and you'll probably fall down because you're not sure which is up and which is down. If you've ever been on a ride that spins you, sometimes you get off the ride and you're still spinning because the fluid and the hairs and the crystals are still spinning. And until they settle down, you will feel like you're still on the ride. Haven't you ever experienced that?
Oh God, yes.
So when you get dizzy,
Like when you look
it's
at
like,
this and then
okay.
you spin a bunch and then you stop and it's
Yep,
still
and you're
spinning.
still spinning. Those crystals are still moving. That fluid endolymph is still moving. So we have the vestibular part here that is telling you where you're at. Are you laying down? Are you face down? Are you sideways? Where are you at? Right? When you get an infection in the middle ear, or the inner ear, it's very serious because it can certainly affect not only hearing but also balance. And I forgot the tube that comes from your throat to your middle ear. And that tube is called the auditory tube or Eustachian tube. It is there to equalize pressure between your ears and your throat and mouth.
It's like when
Sometimes when you do your nose like this and push and it pops your ears, that's what's happening. Or when you're in an elevator and they pop, you're trying to equalize that pressure, or plane. Okay? You ever had pain when you're flying or landing? You need to use those little ear planes. They're a godsend. They're these little plastic devices, you just screw them in your ear. They help to equalize the pressure. They're the best.
Where'd you get those at?
Walgreens, but I bought a bunch online because they were cheaper, Amazon. I bought the kids ones because they're more comfy for me than the big ones. You gotta get those. It's the only way to fly. Telling you. Any questions on the ear? Pretty simple, yes sir.
So, like, kids, they get something called tubes put in their ears?
Yes, so
are
what
those
they
for?
do, they have a lot of middle ear infections. We get a lot of middle ear infections because of that throat.
Okay.
So they're not draining well. So what they do is they put a tube in here to drain better down the Eustachian tube.
Okay.
And usually the tubes fall out, or,
Yeah.
but yeah, they do a lot of that now. You know, in Europe they said that we should never have given antibiotics for ear infections. They're pretty common, and that, you know, even though kids are in pain, they would get over them.
Mm-hmm.
Body will take care of that, but not good. So, any other questions on ear, eye, or brain?